Thank you for being here.
Thank you, Tony. Thank you for asking me to spend some time chatting with you and your audience. I appreciate it.
As we talked previously, one of the things that really first kind of got me interested in what you were doing was your background in psychodrama. And also, I know you're a therapist, you're a writer, and some other things. So maybe we could start with
I mean, I
that.
think from the outside, people might look at my website and say, oh my gosh, you do so many different things. But to me, they're all under the umbrella of metaphor and narrative, whether it's in the camp of healing, like therapy or coaching, or whether it's about writing or training to be a therapeutic writing professional. So I started in this work through the door of writing. I was in an MFA program teaching English, writing, publishing, largely loving what I was doing. But I took a break from it and went on a cross country trip and had a very severe car accident. And that was really the showstopper on that particular degree and put me into a world of rehab and healing. And I'm totally fine now. But at the time, it was a pretty dramatic accident. I was like 24 and didn't know I had a blood sugar issue and fell asleep with the cruise control on and crashed at that speed. So it was like a thing. And when doctors are around your bed with a book out, this was 1991, and looking at each other going, wow, it's kind of a thing. So I did not have designs on becoming a social worker at that point. I was going to do healing narrative work through the door of the humanities. And the person I liked the most in a month-long stay at the hospital was the social worker who talked to me about like, how are you doing? How are you really doing? And the food is kind of okay and pointed me in the right direction and talked to me about how I felt about the surgeon and just was a human being in the middle of a horrible moment. And so I got to thinking after all the treatments that I needed for 6 months to kind of put myself back together, I ended up going towards social work school to do that work through the door of healing as a therapist, not just as a visiting artist or as a writer. So I know that's a really long road to answering your question, and I haven't even gotten to psychodrama yet. But to me, that's the embodiment of metaphor on a stage or taking what's internal and externalizing it, which to me is really what narrative and all of this work is anyhow, if that makes sense.
Yeah, it does. So the therapist, rather the social worker who came in to visit you, um,
Well, he worked at the hospital, so he coordinated all the services that I needed.
yeah. And it sounded like he was really interested in hearing your story, getting to know you,
Definitely.
and that was somehow healing. And you say it externalized. You mentioned the idea of externalization of
Well, that's psychodrama for me. You had asked about the psychodrama connection. And to me, all of the expressive arts take what's inside us that might not have language or might not have shape or form and allows it to be outside of us. And if it's a symptom of repression, that's really helpful to have it be out here. And then I don't have to carry it and it's not quite so heavy. And maybe I'll have a dialogue with it, or I don't have to talk directly about it. And it's perhaps a metaphor that carries the pain or the difficulty or the fear that people are going through. So it was just sort of my road to a career change and no longer thinking about being an English professor as much as thinking about being an expressive arts therapist. So that was really the bend in that road, no pun intended, or maybe pun intended, I don't know.
Can you tell us something about your work right now? What are you doing, and how do you apply narrative?
Well, yeah, well, right now I'm talking to you, which is a great story. And my day looks like a lot of different things. I have a private practice, so I do have individuals in psychotherapy, largely in person, but some video still. I work in Connecticut and New York State as a clinical social worker. I have some groups online. I have a psychodrama group online. It's not a training group, but it's a personal growth group. And there's people from all over the world because it's personal growth and it's not therapy. And that's sort of a skill building group. I teach at a couple of schools. I teach at Columbia in the social work department as an advisor and getting ready to go back to external supervision. And I teach at Adelphi in their social work department as a lecturer and professor. And then I also train people on the side in narrative work, specifically poetry therapy and journal therapy. So that's like a window into all the different buckets. But it feels to me like it flows together. It doesn't feel like I do a bunch of different things.
Yeah, it all seems really related, and I'm just really interested in the idea of narrative therapy and I think you said poetry therapy.
Yeah.
And so how is that different from narrative medicine, which says it's you may experience this as therapeutic, but not therapy. So how does narrative therapy actually work, do you think, versus narrative medicine, which I think also has similar benefits and perhaps outcomes?
Yeah, I guess I don't get hung up on the labels except for educating the public. Like I said, I can do therapeutic narrative work with somebody from another country because I'm not doing it under the auspices of therapy, which has a lot of legal rules about catchment area and what's the implicit agreement. Am I treating an illness? So I'm very clear when it's about the public's expectation of what the service is, but how the work differs, I feel like I mean, I don't use the words narrative medicine as much in my world as I use therapeutic writing or the therapeutic use of poetry. And I think that's about enhancing adjustment, growth, factors of wellness, um, dealing with something that might be a consequence of development or, all the things that are happening in the world right now might not be therapy goals, but they might be adjustment circumstances. I did do some training. I don't know if you know him. He's passed on now with John Evans at Duke Integrative Medicine Center in narrative medicine. And he worked with James Pennybaker, and their model is in the camp of narrative medicine that you don't have to be a therapist or a clinician, but you can be therapeutic. And their particular course was a requirement at the medical school at Duke to learn writing techniques in narrative medicine. So I just think it's the population target changes, the role changes, and the training is different. I use poetry as therapy as a clinician. It's not poetry in therapy, which another arts professional could use, or the therapeutic use of poetry, which an English professor could use. So I think it's really very much about the scope of practice and the legalities often.
Yeah, so it sounds like you're doing a combination of therapy plus personal growth that may not necessarily be therapy, but has some therapeutic events or therapeutic benefits, if I'm understanding that correctly.
Yeah, I don't call it therapy, and it's not therapy if it's outside of New York or Connecticut where I'm licensed to do therapy, but I think a lot of things are therapeutic, whether someone is a therapist or not. I'm just very clear on the service based on, like I said, who's coming and why they're coming and who's paying for it, basically. Are we using insurance and it's therapy, or is it a wellness service and it's more coaching?
Hmm. Can you say more about that idea of poetry as therapy or as having therapeutic benefits?
Well, for me, again, as a poetry therapist, so, in this country, we have the six expressive arts. So there's art, dance, drama, music, psychodrama, and writing. And so anyone that nobody owns the arts, so anybody could use any of those approaches, hopefully with training or consultation for therapeutic benefit. There's some people in a program that I teach at Adelphi who might be developmentalists or teachers or not mental health professionals. So they would be applying it therapeutically. But as a licensed clinician, when I used poetry as therapy, it's the main feature of the session. We might be speaking in metaphor. I'm listening to people's organic metaphors. We all speak in metaphors all the time. It's whether or not we're harvesting and catching them. I have a library of poetry in my head and in my computer. So I might hear something that somebody says and say, "Ooh, that's just like William Stafford's poem, The Way It Is, about following the thread." And maybe I'll bring that into the session, which is super easy on Zoom. And in the moment, we'll do some writing spontaneously if it's really connected to what they brought in to the session that day. And in that way, the poem is the therapy, and it's really the center of that person's treatment at that time.
So let me see if I understand. So you really pay close attention to the metaphors that your clients are speaking, and then you can relate them to actual poems. Um,
Absolutely. Absolutely. And, I take careful notes when people are talking, not, for medical record purposes, yes, but for this purpose, artistic reasons. And sometimes people's speech is a poem. So if someone's having trouble feeling witnessed or feeling heard or being mirrored, I will read back some lines of what they said. And it's actually very poetic and just sort of craft it or shape it or be their scribe. And that's very healing to people to be heard in that way. I'm actually part of another program. Maybe you've heard of it called the Good Listening Project. And that's exactly what that project is about is gathering often healthcare stories and being a witness for the poemy and feeding back in a process of reflective listening on the page. What is the story that I heard you tell me in a poetic form? And it's like a gift to the poemy, and they get right of first refusal and editing rights. If something's not right, they say, please change this part or please take this out. And their particular project is de identified. So it's more about getting stories out there rather than revealing identities so that people feel more free to tell their stories as well.
yeah, one thing you said that really fascinates me is this active listening idea of repeating back or summarizing or somehow letting the patient know, the client know what you've heard. Do you find that people are frequently surprised by the things that they say, but they didn't really heard them say it until you reflect that back to them?
I think so. I think they're first surprised that someone is listening that deeply because we are often not deeply heard. There's the soundbite society. Certainly nowadays, if you can't do it in a 30-second TikTok, some people aren't listening at all. So I think the first surprise is that there's a live person interested enough, even though it's my job, you can do your job at various levels with a certain degree of heart. And I think people are first shocked at what it feels like to be heard. And then they might be shocked at the content. Like, wow, did I really say that? Did I say it like that? And just being able to be a mirror that hopefully is as clean as possible. I don't want to be a funhouse mirror that distorts, but that's the purpose of working on oneself, right? To be as neutral of a mirror as possible.
Yeah, it's kind of interesting that people who come to you to be listened to are surprised that you're actually listening.
Yeah, well, therapy is largely centered on witnessing and listening, at least good therapy, and curative therapy, where we give a corrective experience. If merely retelling a story was healing, then a lot of people would be healed about many things about which they obsess. But I think it's the way in which somebody listens, the intention, and sometimes the purposeful interruption to, you probably noticed the name of my business is Change Your Narrative. And I feel like we all have internalized stories, some of them accurate, some of them distorted. And what is the story that we wish to tell? What is the story we want to manifest? And do we need help with that gap in between the story we're telling or listening to and the one that we wish the world new. And to me, bridging that gap is what therapy is about, to be whole and to feel that we flow and all of our parts are connected and know each other. So most of my mental health training is holistic and gestalt. It's not so much about pathology, it's about wholeness and wellness and flow.
Um, do, do you find that people, well, as people change their narrative, I think that's part of what you do is help people to understand what their narrative is and then change it. How do people change their narrative? Can you give some examples, of course, without naming names or anything, about how people change their narrative as you're working with them?
Yeah, I mean, I think there's lots of steps to that. That's obviously a complex question. First would be to be able to hear oneself. So some people do that through journaling or through that reflective witnessing process to be able to hear, what does it seem like I'm putting out there? How is that perceived and received by other people? And sometimes it's an approach that I might use in therapy. For example, EMDR looks at people's cognitions and how are they negative or stuck or self-evaluative in a way that's not fair or accurate to the moment. People who've had trauma often will turn that negativity inward as a form of trying to master an unmasterable experience. I'm unlovable. I'm broken. I will make sure this never happens again. That becomes a narrative if you self-tell it and hear it long enough. And so, how could we externalize that? Sometimes I'll give people the ingredients of a fairy tale and have them use second or third person and distance a little bit. So have a hero or a heroine, have a force of evil, have a force of magic, and have some kind of resolved ending. And then they'll tell a story. Once upon a time, there was XYZ person who had a terrible event happen and then began to feel such and such way about themselves. And when it's a story, rewriting it feels easier to people than to on purpose change how they think or change how they see themselves. So it's engaging through the metaphor or through the power of story being out here and then being able to re-internalize that and see oneself differently. But that's obviously through a process that's also relational. I think that's part of what works is having an expert companion, they say, in post-traumatic growth work, or a person on the path who's maybe a few steps ahead, but not somebody in an ivory tower who's analyzing, trying to figure you out. I don't think anybody likes how that feels.
Can you go back to the accident that you experienced and your month in rehab? How
Mhm.
did that social worker help you to change your narrative? What was it when you went in and at the end of this process that put you
Hmm.
completely on a different path?
That's a great question. I don't know that it was him. I mean, he was there as a constant person,
Mhm.
and I think he gave me a container for my feelings, and there were great nursing staff there. A lot of the interactions, as you probably know, in medicine are so transactional. So his relationality kind of gave me space to think about what I had gone through instead of think about my body as broken or a collection of parts. And it's funny, I've been through other accidents and events in my life. I'm almost 60, and this happened when I was 24. I don't think of it as the worst thing that happened to me. I think of it as one of the best things that happened to me. I found out I have a blood sugar issue that I since got to treat, and I didn't know that. I changed careers in a way that made my life open up and feel very fulfilling. Uh, I am in acupuncture, for years and years and years. I was an EMDR client. So I've gotten to sample things that I don't think I would have had I not kind of been pushed, which is what happens through illness, right? Your boundaries are broken and you either change. I think it was Auden who said we'd rather be ruined than change. And sometimes there's that precipice of a wake up call. And so I took it and it was really healing for me. not everybody's story is that way. And I think being a therapist, at least the way I look at it, makes you walk your talk. If you're going to be resilient, not burned out, and a happy therapist, you're also getting therapy or working on yourself in some way. And I really like that. So for me, it was an event that led to many great things rather than a horrible story that crushed my life, because I don't feel that way. And actually, it's a great question that you ask. The person, because I also do somatic work, and it's Peter Levine's somatic experiencing model. And one of his questions is, what was the moment that you knew you were going to be okay when you're working with somebody in a trauma? And it was really a truck driver who stopped, who was behind me and sat with me on the side of the road and had a shock blanket because they travel with first aid kit and all that stuff, and kept me talking until the ambulance got there and asked me questions to keep me oriented because I had a head injury. And he was asking me about poetry therapy because he's like, what do you do? And I was telling him why I was driving to New York to see some friends of mine. And so that guy, whose name was Michael, and he and his wife came to see me at the hospital. It kind of chokes me up a little bit right now, all these years later. He was really the seminal turning point person, because that's healing, whether he had the title of social worker or not. It's that human compassion and ability to be present in the moment that just like blew me away. And I stayed in touch with them for years, through cards and letters after that event. So that's a great question. I appreciate it.
Well, one of the things I wonder about you too is that are you open to people in such a way that you really recognize the help when it's in front of you? I don't know that everyone has that ability. Depends on the situation, of course.
Yeah, I
But
guess I would change that word to opportunity. I think people have the capacity, but do they have, as I cry on your video, do they have the access or the opportunity? I mean, one of my favorite TED Talks, and maybe you know it, is oh my gosh, I always forget her name. Um, Chimamanda Adichie, about the danger of a single story. And she's a Nigerian writer who grew up reading European stories about little white girls who had blonde hair and blue eyes. So she went on to write stories about white children who had blonde hair and blue eyes. And she did not see herself reflected in the stories that she read. And so, if the danger of only having a dominant narrative that is, of course, pushed by whoever has power, is what happens to all the other stories that don't get to be heard. So I think less of the capacity of the person and more of the opportunity of the circumstance, that given the right conditions, and maybe I was born in Colorado, so maybe I'm an eternal optimist or naive in some way, but it works out for me that people do show up ready to do the work, or they don't stay very long with me because they get what I'm doing and they're like, ooh. But most people who hang out, stuff happens.
I'm just fascinated by this idea that you get into an accident, you're sitting by the side of the road, this stranger comes along, this truck driver, and he essentially keeps you alive or conscious. I'm not sure if he
Yeah,
kept you alive, but kept you conscious, kept you talking. It just sounds like a miracle, in some
it
ways.
felt like a miracle. Yeah,
Yeah, this person who comes from nowhere, a truck behind you. That's just fascinating. And then along the way, you had other help, the social worker, the nurses, the other experiences, and that rather than conceive of yourself as broken, it created new opportunities. Well, the idea too of it. Then there was this discovery of the blood sugar issue, I think you said. Um,
yeah,
so that
yeah.
the trauma was actually a moment of discovery in many multiple ways, it sounds like, not only
It's
physical,
true.
but emotional
It's
and
true. And without getting too graphic, like it was a compression fracture. So I was literally hit so hard on the top of the head that my first cervical vertebrae split into three pieces. That's not a thing that most people get to talk about after it happens. Like it's a thing where people might dive into a swimming pool when there's no water, like if it's dark or something, or, there's a big party and someone's inebriated. That's that kind of injury. And so the fact that it happened and I survived it and I'm totally fine is amazing. And I think the process of it was what was healing. And some of the medical staff, I mean, this was a long time ago when people weren't trauma informed, but the X-ray person, when she was doing the X-ray, she said, "Open your mouth and like you were screaming, like the way you would have screamed during the accident." That was an invitation for a release. And not everybody's trained that way. And my really great osteo guy showed me a picture of what the bone looked like when it was healed. Because in your head, you know what it looks like when it's broken. But the thing to hold on to is, well, what does this look like when it's not broken? Because that's the new story or the new memory. And even seeing the stronger marks where it was broken, like that's a cool image to hold on to. Not every doctor is going to show you the healed x-ray. So there's some really cool people in medicine who are doing some great work as well.
Yeah, you really bring up this interesting idea of the mind-body connection. And can you talk a bit about that, the relationship between the mind and the body and how they work together? Does the mind actually, is it actually um, have some power to heal? Um,
I think so. I mean, I guess it depends on who you talk to, right? So I'm an integrative, holistic therapist. So that tells you that I don't think the mind and body were ever separate. I kind of laugh at the Western world that thinks that it's innovative or new to have integrative medicine. It's reintegrative. It was never separate. Only we thought in the Western world that mind and body were separate. A lot of the work I do with the nervous system, and people are amazed when they learn about their own nervous system. I'm in a program with Eric Gentry, who's a very famous trauma therapist. And part of his teaching is the nervous system only knows the present. Your brain can have thoughts about the past and the future as a mental activity, but your body only knows to respond as if whatever you're thinking about is true and is happening right now. So I practice biofeedback. A lot of us had pulse oximeters during COVID, sitting there obsessively checking our oxygen level. Like when you see how thinking stressful thoughts changes your biomarkers, or relaxing and meditating changes your HRV, or if you have all the fancy, I have my Aura ring and people have their Apple watches, it's information that will sometimes keep people engaged in a health practice because they want or need that proof. But it's been true all along that the mind and the body are completely interrelated, and the soul, I would say, but that's probably a whole other video to get into the soul.
yeah. Well, we could talk about that now. Do you have any thoughts about that since you brought it up? How does the soul fit into that? Yeah, that's
Well, I'm a spiritual person, so everybody might not look at it that way, but the psyche, if you really look at the meaning of psyche in psychology and the history of psychological work, it's an integration of intellect and emotion and sensation and behavior. It's not compartmentalized the way, I think we take things apart to learn them, but I don't think sometimes in education we're as good at putting them back together to use them. And so to me, of course the soul is there, of course the psyche is there. How could it be anywhere else? And whatever door you go in through, I feel like all the other pieces get revealed. So I have great admiration for my friends who do cognitive behavior therapy, and it doesn't involve interweaving other things. That's not my interest, but they're super good at it. So yeah, I think there's a lot of different specialties that should talk to each other more, because how rich could that be?
where did you learn to integrate so many different practices and fields in your work?
Probably by buying them first, by being an experiment of one and trying things. And my husband makes jokes that if Amazon had a taste tester, we would be rich because I see things and I'm like, oh, let's try that. I am not afraid to be somebody who tries the latest, newest thing. And I think it's also an orientation towards integration. And honestly, it's also social work. Social work is a very inclusive approach that doesn't have a dominant theory that it sticks to. It borrows from many different aspects: attachment theory, object relations, ego psychology, and trauma theory done well is really attachment and object relations with nervous system. And I love Dan Siegel. Like, it's really probably the people I follow. He's integrative. Ken Wilber, very integrative. I like Buddhist psychologists. I follow Jack Kornfield and Pema Chodron and Tara Brach. And to me, they're all speaking about the same thing in different ways and stretching myself to learn those different ways of saying a similar thing keeps me fresh and doesn't let me start to think only one way, because then I'd be closed to somebody who comes in. If I need them to fit my worldview, I'm not listening anymore.
Bringing it back to this idea of psychodrama, I know that's what initially caught my attention because I can, without getting into the specifics, I
Yeah,
can say that my experience with psychodrama really fundamentally changed my relationship with people in my family, how I looked at them, because it kind of got me to come up with a story that was not in the moment, but multi-generational. And again, I don't want to get too, too specific about that, but how did that work for you?
it's a great question. Um, I'm smiling because we're acknowledging the complexity of it, and it's almost hard to talk about without going into too much. I think because I'm on the path of wanting to be a trainer and finishing my certification in psychodrama and going in the training path, it's pushed me to take the elements of it and try to break it down and explain it to people. So I'll try. I don't know if this is going to do what you're looking for. Drama therapy is about playing a role, and it may or may not be you. Psychodrama is intra psychic and interpersonal. So it's real. What's on the stage is some approximation of something that's real in my life. And we look at all the research from Bessel van der Kolk, Dan Siegel, all of the functional MRIs that we now have access to. We know that involving the body in real time and integrating the past and the present and an idea of the future in the presence of caring witnesses is how we heal trauma. So, psychodrama and having auxiliary egos in the form of other people in a group who are willing to play parts. Somebody, and I've done my car accident, somebody was my car, somebody was this guy, Michael, on the side of the road, somebody else was the social worker, somebody else was the nurse. And it's not to re experience it exactly the way that it happened, it's to feel it and integrate it with the support or with the knowledge for my body at the time that I survived. Because I was afraid. I mean, imagine this part. I was afraid to fall asleep because how did the accident happen? I fell asleep. So I had a lot of sleep trouble, and a lot of the first treatments were about how to have a relaxation response deep enough that let me go to sleep without jerking myself awake, because that happened for a few months. And that was really that startle response. So I think psychodrama can take a situation, create a scene, and then create time. So there's the scene of the past, and then there's the scene of the present. And what's the wished for scene of the future? And how do we integrate a resource that maybe you didn't have? You could take surplus reality, they call it. I used to work in a hospital with kids, and a lot of them would want to rescue themselves from their abusive situation. But they couldn't do it because that would be like admitting that their parent was bad. But they could have Superman do it, or they could have Spider-Man, or I don't know all the superheroes, Wonder Woman. I have to do a bid for Wonder Woman. They could have them do it. So they would pick somebody to be in that role and they would cast themselves, the director would put them in that role of being rescued. So even though it's not what happened, their nervous system got to feel activated again and then also rescued in ways that aren't what happened, but it's also very real to the body and the nervous system. And that takes hold and that gets metabolized just the way that a medicine would get metabolized. So I don't know. That's my best attempt, Tony. It's a hard thing to explain.
Yeah, well, I think one of the things that I can relate to was the difference between talking to a therapist about what was going on with me, but then being on a stage with the different actors that the director then called up to play the part after hearing some of
Yeah.
my stories. So being surrounded by living beings who were then acting out, parts of my internal drama, I thought it was exceedingly powerful and
Yeah.
moved me forward in ways I don't know that I could ever have gotten to directly simply by speaking the story. At least
Yeah.
for
And,
this
and
particular issue, it was just powerful.
And I don't know if this was true for you, but tell me, were you in both positions, like in the mirror position, watching somebody have your role and then being in it, feeling how it was to be you in the scene? Did you guys do both of those?
Well, no, I had a number of different experiences, but the one that was really changing was I was witness to the women in my family going back generations who I never met pass on a significant message from one woman to another to another to my mother to me. So I witnessed the the message from the generations that had been distorted and whatever in my
Wow,
mind. So I witnessed this, and it was just the most amazing thing I had ever witnessed in some ways. To
very
hear
cool.
from the past this significant message, but the director really first had to pick up what's the issue here, and then get the actors who were called up to then play the role. And the whole thing lasted maybe a minute, but it was like witnessing this multi-generational drama unfold and made me wonder how long has this message been passed down from one generation to another to another. It was just extremely powerful, but it was really different than just simply talking about it, but witnessing it.
Yeah,
Uh,
for sure. And if I was, like listening to you now, in terms of mining metaphors, to borrow symbolic modeling's language, I to me the title is almost like what's the message you got that you didn't hear? And so
mhm.
you got to hear
Have to hear
the
it.
message that you have received and lived, but maybe didn't get to experience. Like, wow, what was that chain of, it's like telephone, right? By the time it got passed down, like what was it?
Exactly. It was completely hidden from me. And then once it was revealed, I could see how it was activated in my life, in my relationship with my sisters, with women in general, and who I chose to be with and all that. So it was yeah, quite revealing to say the least. But that process of being on stage and seeing it acted out for me was really key. I'm really curious too. A couple more questions about
Sure.
what you're currently writing about. I,
Hmm.
I assume that you continue to journal yourself, and you don't have to get very personal, but I'm curious about what you're writing about and what your
Yeah.
process is.
I'm always writing something. So I do keep a supervision journal, a self supervision journal. And I
Mhm.
got this idea from one of my trainers and friends, Kay Adams, who's a journal therapist. So I keep notes all the time about my process regarding my practice. Maybe it's what I need to write down before I can go to sleep and something I don't want to think about, but I want to have a place to put it. Maybe it's a letter that I write to a client who left unexpectedly. That doesn't happen too much, but sometimes it does. And of course, there's the legal clinical letter that you send. But what's the heartfelt thing that I didn't get to say because I didn't get to see them again? So I'm always doing some kind of processing writing. And right now I'm finishing up some poems for the Good Listening Project of people's healthcare stories, which were just so touching. I mean, they range from a woman whose father is in care with dementia during COVID and what that was like for her, and another person who had a baby with the intention of having it be midwifery in a birthing center. And then there was a medical event and she had to go into a hospital setting. And her whole plan, which she had spent so long crafting, just completely went out the window. So just really touching stories. And I have a desire to co-write a textbook, but everybody I talk to about it gets scared and says no. So I don't know. I'm looking for partners in crime to collaborate with because I do like to work on joint projects. So that's probably a good short list for the moment.
Well, can you say what that book would be about?
Can you say that you would be a co-editor? I'll do Ken, who was the guy who used to do it? James Lipton, yes, the Actors Studio. So I'll ask you a question back. Maybe you'll join me as a co-editor. I think I would want it to be about the expressive arts in stories in some sort of medical or healthcare setting. And I've recently gotten my husband looped into my world. He's an insurance guy who was going to get an MBA. And I said, hey, what about an MPH? And he first didn't know what I was talking about. And now he's halfway through it. And he's super excited about narrative medicine and the idea that I'm going to do Columbia's program. I plan to start in January. And he's interested in the stories of people who are marginalized in healthcare. So it might be like a interdisciplinary book from business folks, because he's in the health benefits and wellness world in corporations, and the practitioners and also educators, because I just see a lot of crossover, but I don't see these groups almost having the time to work together. And they speak such different languages and they're working with such different payment systems. But how could it be helpful for them to be in touch about their overlapping goals? So just spitballing here, and that's what came out, but that would be probably my dream sort of project or book.
It's so interesting that you are a relentless integrator.
Relentless. I say tireless.
Tireless. Well, maybe same thing. Not, yeah, in a good, relentless in a good way. Just you won't, you cannot not integrate. It sounds like
That's true.
the fact that you got your husband who's involved in insurance to be involved uh, in a psychotherapy endeavor, perhaps is really just fascinating. But it makes complete sense. You know, you really brought up the idea that medicine has just it's overly focused on one thing, and it does that to death, to the exclusion of other things. And here you are putting all these puzzle pieces together, connecting the dots in a way, looking at the different threads that run between one discipline and another, one practice and another. Um,
Well, and to be honest, to be fair about my husband, it's a second marriage for both of us. Part of when we met, he had just recovered from stage 3 colon cancer. And he had great treatment. I'm not going to name the facility. It was great treatment. And he had a digestive cancer, and nobody talked to him about nutrition changes. And so one of my certificates is integrative nutrition. Of course, it's integrative. And he was like, what? I never knew these things. And I had him in acupuncture for his neuropathy, and that resolved. So he started getting curious about integrative medicine and Western medicine being good, but clearly a profit system in this country is different than any other system in the world. And we have friends in Europe who can't conceive of how or why you would ever lose your house over a health event. They're like, what do you mean? And so he's really interested in changing the system that we have in ways that he didn't understand until he was a patient of it, which is probably true for a lot of folks, right? That
Mm.
empathetic ability to reverse roles, back to psychodrama. Can you put yourself in the shoes of another person? Not just how would you do in their shoes, but how do they feel in their circumstance? Like that's a big deal to be able to do that.
Yeah, one of the issues with narrative medicine is how do you practice it in a country where the business model is get them in, get them out, in 7 to 12 minutes. And
Yeah. Well, I also live in the EAP world, so I do a lot of talking to companies in their employee assistance program. And it seems like, and my husband says this as well, as soon as you hook something to return on investment, then people are interested. Or one of my psychodrama trainers, Rebecca Walters, did some improv, medical improv and psychodrama with a major cancer center. And part of how people become interested is once it interfaces with what matters to them. If that's reducing liability or increasing patient satisfaction, you have to get the buzzwords that are meaningful to the people who have the power, I think.
so you have to, yeah, we have to essentially prove what's the return on investment when it comes to actually listening to patients, listening to their stories, and helping them to understand what's going on with them. It's a hard sell.
It is a hard sell, but I have hope because like or don't like Brene Brown, to have a social science researcher popularizing, operationalizing discussions about things that were previously thought to not be quantifiable or measurable in a way to have a meaningful, respectable research conversation. That's kind of cool. So, why couldn't something like that potentially translate to a different kind of ACEs study with what are patient outcomes when people feel deeply heard versus business as usual? I think it is possible. It's the interested parties and probably universities with IRBs and people with resources and time to be curious to do that kind of a study because we certainly are not in any shortage of people with illness.
That's for sure. One more question. I've been a medical educator for over 30 years, and I've seen a change since the early 90s when I got started in the amount of women coming into the medical field. My stepdaughter is a physician, in fact. I just wonder how you see how women increasingly entering medicine will change the field, or do you think that the women have to kind of emulate the males
Hmm.
in terms of their practice. But do you see women changing the field at all over the course of
I
time?
I hope I'm not an annoying interviewee. I mean, gender certainly is an issue, but I think of energy. So to me, it's more about is the energy masculine or feminine? And even that is old and stereotyped.
Mhm.
Is it sensitive? Is it attuned? Because we don't want to think of that as female and facts and, get down to business as male. How do we humanize the practice of medicine and not have it be gender bifurcated, but have a standard of care be involving coming from the heart? And I do think there are some other cultures that do that better and do that differently. They have other problems that perhaps we don't have, but I think we could take a page out of their book in some of those respects and see how more humanity in the process, could be helpful. I know, and I have a lot of friends in the UK. So because they have an office for the Minister of Loneliness, and they look at social isolation way before our Surgeon General, which is good that we're looking at that. But this is like 15 years ago they were doing this. So you could conceivably get a prescription from the doctor to spend more time in nature or to join a support group on a prescription pad because that would be considered the intervention for the holistic person, not just in a disease focused way because their system is just wired completely differently, their medical system.
Hmm. Well, on that note of it's not about gender so much as energy. Let's stop here, and I would love to continue talking with you about this. And so, thank you so much. This has been just such
Oh
an
my
interesting.
gosh, you're welcome.
And I would love to, by the way, I'd also love to hear some of your poetry at some point too.
Aw, thank you. I would love to share that. Sure.
That's a subject for another conversation, but let's please try to talk again. Thank you so much, Nancy, for your time. It's just been a great,
Oh,
interesting
thank
session.
you. Thank you, Tony. I hope I didn't make my answers too long for your time frame.
It was perfect. Thank you so much.